The Simulation Training Center in the emergency room is a brand new state-of-the-art simulation training center. It is a high-fidelity simulation center, so what that means is that the mannequins have the capability to talk back to you. Simulators can breathe. They have real heart sounds, lung sounds. You can actually puncture their chest, put breathing tubes down their throat, almost treat them as if they are a real human being, which allows for a more realistic educational experience for the learner.
The simulation seemed like it was very real to me. We were able to dispatch the ambulance like we ordinarily would to be on scene. The simulation mannequin was very lifelike. It talks, was able to communicate with us. So it was very, very real.
High fidelity simulation is a newer way of training, and it's evolved over the last 10 to 15 years. The purpose of which is to gain more interaction with the learner.
It's a great place to refresh skills that are used infrequently, to learn new skills, and to refine processes that really require a team approach and everyone being on the same page at the same time.
In healthcare, there truly is always situations you can't plan for. You can't expose everybody to everything. The sim lab gives you the benefit of creating a simulation based on an experience that may not necessarily look like the experience you're going to have with the patient, but it allows you to prepare for it. It allows the experts to work with the novice to get them critically thinking about what could happen.
We're looking for better infection rates. We're looking for improved, shorter times in the hospital, those kinds of things. And we're able to do that through simulation by taking the best care of our patients that we possibly can, having our staff prepared for those high-risk, low-frequency problems that might come in the front door. We're able to take really good care of that patient and get that patient turned around and back to a healthy way of life.
Studies have shown that a learner can only pay attention in a lecture for about 10 to 15 minutes. So what high fidelity simulation allows for is interaction and essentially resetting of that clock.
It allows them to take all of the skills that they have, their education, observation, everything, and start putting it together. And they're able to respond to situations intuitively because they've seen them before. It's not new, they won't freeze.
The way that a simulation is organized is initially it is the simulation where the learner is in this interactive environment where they're talking to the mannequin, doing procedures, talking with their cohorts who are in the simulation with them. And then the next half of the simulation is what's called debriefing, where, for example, in our lab, we're able to record the actual simulation, then play it back on a screen, and you sit and you discuss what happened in the simulation.
We work in groups so that we can talk about as a group what we did well and what we need to work on better for the next time. And so it's a very important part. Debriefing is a very important part of the simulation process.
If we make mistakes, we're able to talk about it, see where we've made the mistake in order to not make it again next time on a real patient.
What is important is not just giving a lecture back to the learner, but it allows for a discussion not just about the science of what happened or mistakes that have happened, but it allows for a discussion of how people felt while they were in there. What sort of anxieties did they have? What fears did they have?
The people who are using our facility is the greater medical community that we serve around us. So that would include the fire department, the police department, EMS, other hospitals, nursing, physician, pharmacy, all types of disciplines within the medical community that we're in. We're focused not just on our own hospital, but in the greater medical community that we live in. I
think that it's good for any EMS agency or hospital agency seeing the transfer of care from ambulance to ER, ER to OR, OR to ICU and whatnot. So I think that it's definitely something that can be utilized by services everywhere.
I think training a sim lab for medical students is a really unique value because it gives them an opportunity to experience things that they wouldn't experience until later in their career. And even for people that have been in practice for some period of time, it's a great way to refresh on things that maybe have changed since you went through training.
What makes this simulation lab so special is not just the fact that we have these high-fidelity mannequins, it's the fact that we have 4 rooms. The 4 rooms are a pre-hospital room, where there's an ambulance, an ER room, an operating room, and an intensive care unit. And why that's important is typically the way that we learn is we learn within our own group. So as an ER physician, I train with other ER physicians. ER nurses train with other ER nurses. OR nurses only train with OR nurses. But in practice, when you actually take care of patients, you take care of patients as a team. What is important is that ability to practice that teamwork, to practice that communication. So what makes our lab stand out is the fact that it's designed for practicing transition of care, for practicing as a team as versus practicing individually. That alone, communication and teamwork, are two aspects that have been shown that if they are improved on, it actually decreases medical errors.
Through interprofessional collaboration, we're able to improve patient outcomes.